Today, I'm with Dr. Pam Kane from Knoxville, Tennessee, who has both taken great steps in learning about the DTR procedure, dissolution time reduction, as well as being a patient who has had the dissolution time reduction procedure. So I wanted to interview her about her perspectives on learning about the T-scan and her educational process she got to undertake the DTR procedure, as well as what it's been like for her to be a patient who's experienced many of the common things that dentists see in their practice of these patients who have chronic pain.
I was trained by the Dawson Academy in equilibration procedures and understanding the system, masticatory system, and how to treat it systemically. It was a journey that I have gone through for the last 10 years or so, where I've tried to understand about orofacial pain, be more in tune, not just with teeth, but just the whole system. When I learned about this procedure, it came in full circle. And I was able to get the aha moment that I needed in order to help patients immediately, efficiently, and experiencing it myself. I have to say it's the best thing. I am a true believer. I do think that it's one of the best procedures that we can offer patients, especially when they're in a lot of pain. Extreme headaches. Chewing gum was awful. Clenching a lot. Pain on one particular tooth. Cold sensitivity. Most of the time, I just dealt with it, and you just take ibuprofen and move on. But when I started learning about it, I was excited to get treated, and I just think it's the best thing. It just makes me believe more and help patients believe in it as well. So I would say maybe 15, 20 years. I mean, it just got worse as I got older. I used multiple night guards. I went through courses trying to use different appliances. Nothing really gave me relief because teeth will come back together and they'll start all over again.
So what were the differences now that you've had a 6-week healing period since you had your dissolution time?
Very minor temporal headaches, very, very minor. I think it went from so large of a pain to just more of a narrowing down to a more specific minor pain. But compared to what it used to be, it was just nothing. I mean, I didn't regret a single moment to do it. And that's why I'm so excited to be able to pass this on to patients, because I've treated staff, and I have to say they are incredibly surprised. They did not think that it would work. They were doing this to help me out. And when one of them had it done just today, she was like, wow, it was huge. No night guard needed last night. She was happy.
So as far as your own symptoms, you're able to chew now
Right.
with less pain.
Correct.
So why don't you describe some of the things that have changed in your lifestyle from not having to deal with this problem as much?
Well, I don't have to take as much any ibuprofen. I don't have to put up with it. Chewing is more efficiently, and I enjoy foods without having to be careful which tooth I hit or not hit. Cold sensitivity is much reduced. I don't have to let the watermelon out from the refrigerator for an hour or so before I eat anything. So I have to say it's amazing. The improvement is so large.
So would you recommend to dentists that they learn about the T-scan and the EMG and understanding this process?
Even if it's challenging, stick to it and you'll see big results. The benefit to patients and yourself are huge. Less margin of error.
The more T-scan measures things for you.
Right. They measure it correctly, and plus you're not guessing. I think that's the big thing, that we think the paper marks the correct areas, but in reality they're not. And you don't know how much force you're putting based on the paper. I think that's the biggest thing that I have taken from the T-scan. And you can see you can see clearly what's going on without guessing. That's the biggest thing that I have taken from this. You won't overdo it or not do it enough. And you're not wasting time, patience, and your own, trying to figure out where you have to go, just seeing paper marks. So I feel like that's a big take-home message.
But it took you some time to understand.
Oh,
the
yes,
T-scan.
yes. It took me a long time. It was something that I had to constantly play with, listen to different videos, Dr. Nick and yours, and try it again, do it again, do it again. It's constant and not giving up. I think that it's easy to give up because it is hard to understand. But once you've done it several times, it's repetitive, and then it just becomes more and more clear. And then you get the aha moments every little time that you find something new that you didn't discover before. That's what I've found. But I have to do it over and over. It's a repeated motion that once you get it going, it's kind of like once you know how to ride a bike, you just take off.
Well, there's no question the T-scan requires self-evolution and self-education because the skills aren't taught in dental school. So a person has to learn to record, has to learn
Right.
to read the data.
Right.
And that's the part that you're talking about.
Right.
And understanding all of that is
Yeah, I didn't have the books. You hadn't had them out. And so a lot was what the T-Scan company would tell me, plus your lectures and looking at videos. That's how I started understanding more. But really, until you don't use it, you're not going to. I mean, you can have it and people can talk about it all day long, but until you don't actually use it and perform the procedures and actually understand it, you just can't grasp it. I mean, it's not worth to pay $5,000 or $10,000 if you can't use it. And a lot of dentists do that. We're terrible. We buy gadgets, leave them on the shelf, and that is such a shame. That's one of the things that you should not do with this. Once you get the hang of it, it's amazing.